On Monday afternoon, Philadelphia police officers shot and killed 27-year-old Walter Wallace Jr. while he was in the midst of a mental health crisis. Wallace's mother was with him, helping to de-escalate the situation. When the police arrived, they fired at least a dozen shots. Wallace died at a nearby hospital soon after. This story is all too familiar. In the last 2 months, Pennsylvania police have shot 2 other people of color who, like Wallace, were in the midst of a mental health crisis. Police in Reading wounded Roxanne Moore, and in Lancaster, they killed Ricardo Munoz. This is what we know. When police respond to calls about mental health crises, people die. Across the country, 25 to 50% of people who are killed by a police officer were in the midst of a mental health crisis, and no amount of police training can solve this problem. Back in 2018, police officers in State College, Pennsylvania, shot and killed Osaze Osagi, a Black man who was having a mental health crisis. One of the officers on the scene was a crisis intervention team leader. They killed Osagi anyway. Police are not mental health professionals, and we shouldn't expect them to be. We can help people in crisis by calling upon community-based mental health services. We can't help people in crisis by asking police who are predisposed to using violence to intervene. Walter Wallace Jr. would likely be alive today if we prioritize mental health care as public health. It is past time to divest from police in Philadelphia and around the country and invest in community services that will save people like Moore, Munoz, Osagi, and Wallace. Join us in contacting Philadelphia City Council members and Mayor Kinney today to demand that Philly develops the alternatives to police that our communities deserve.